Mr. Fox.
Hello, I was invited here to talk about the cost shift from Medicare and Medicaid and the impact that has on private insurance premiums. I'm from Milliman. We're the largest actuarial employer in the country. We're very focused on our independence and not advocating advice. They're just give you some numbers and not with a specific slant on them. We've completed cost-shifting studies for Arizona, California, New York, and Washington. We're currently working on a study in Oregon and a nationwide study. So I have a PowerPoint presentation. I was told that might come up, but I don't know if that will. But anyway, you guys probably have handouts. My presentation is going to cover 4 main points. What is the cost shift? How large is the cost shift? What's the impact on private insurance premiums? And what are the trends? Where's this going? So, what is cost shifting? In most areas of the country, for the same service, private health insurers pay a lot more than Medicare, which pays more than Medicaid. So in other words, if Medicare and Medicaid paid higher rates, the private payer rates could come down, and private insurance premiums. So we should be on the 4th slide now. If Medicare and Medicaid could pay more, the private insurance payers could pay less, and private insurance premiums would be lower, with the providers, the hospitals and physicians, still making the same income. So some consider this to be a cost shift, to be a hidden tax, that effectively employer groups and privately insured people are subsidizing Medicare and Medicaid. So how large is the cost shift? So to quantify that, I will warn you, this is a sample based on the 4 states for hospital and 3 states for physician. So the variability from state to state is tremendous and can be very significant. But these are generally pretty indicative of what's happening. That on the hospital side, what we're showing here, pretty hard to see on the screen, but hopefully you have them in front of you, that if a hospital has an average cost of, let's say, an x-ray, it's $100. Then the commercial or private insurance payers are paying about $115.90. And for that same average $100 cost, the Medicare is paying about $90 and Medicaid is paying about $86.50. So 13.5% less there in your chart. On the physician side, there's no fixed cost, but if we take the average reimbursement that physicians get, they're getting about $100 on average, let's say, for an office visit. Then they're going to get about $110 from the private payers, about $90 from Medicare, and only $76 from Medicaid. So going on to the next one. So how does that cost shift impact the private insurance premiums? Well, using California as an illustration, we've got a total annual premium of $13,800. That's an annual premium for a family, employee, spouse, and children. The cost shift is about 12.2% of that, or $1,690. You can see the breakdown in the graph there of the employers pay most of that, as Karen had just said, 75–80%. $1,234 is paid for by the employer. This is just the portion that's due to the cost shift. So this amount would be reduced if there was no cost shift from Medicare and Medicaid. And $456 is paid for by the employee, the portion that's paid by the employee. But on top of that, the employee's coinsurance and deductibles, other things, are also increased. So $298 comes from the cost sharing to that employee. So where is the cost, how's the cost shift changing over time? And this is a really powerful graph that, if you can see it, that it's reducing. What happened in the 90s with managed care, the cost shift reduced and things came together, and now it's been spreading apart. And what happened there in the 90s was not that Medicare and Medicaid increased their payments to reduce the losses on Medicare and Medicaid. It was that the commercial private payers reduced their payments. There was a lot of competition, and the hospitals and physicians managed to lower their costs or lower the reimbursement so that then they made more on Medicaid and Medicare. Now, what's happened since then is either the cost pressures or other things, which I'm not getting into the solutions, just quantifying the numbers so you can understand them, is that since then the costs have been higher than the Medicare and Medicaid increases, and it's leveraging effect to increase that cost shift. This is well illustrated on the next slide, which shows that if you have a 5% cost, so the hospitals, let's say they have a 5% increase in their costs, and Medicare only pays them 3% an increase, and Medicaid pays them a 2% increase, then the commercial private insurance payers, they have to pay 7.3% for that hospital to get the 5%. And that's really how the hospitals negotiate. I do a lot of hospital contracting work. That they're out there saying, hey, here's our bottom line, here's what we're getting, you guys have to pay us the rest. And that's what's contributing to the high increases in commercial health insurance and part of the cost there. And the last slide I have is just to illustrate some of the variance. This is the hospital margins by state. Again, we're mixing different states, different years. We are putting out a national study in the next couple of weeks, sponsored by a few large groups. But it is important to know that this is very different from market to market. Even within a state, I've done some work in Pennsylvania where some parts of Pennsylvania, they make money on Medicare, the hospitals do, and some parts they lose a lot of money, and so the cost shift, and then commercial insurance premiums are a lot higher. Thank you.
Thank you, Mr. Fox.